Good morning and welcome to COVID-19 Talks with local health authorities. Joining us this morning is Dr. Erica Brown, Health Authority for Harris County, and we also have Dr. David Purse, the Health Authority for the City of Houston. Special thanks to past President Kathy Finnegar, the Rotary Club of Houston, our producer, Morgan Ash. I am Janina White with the Deputy Health Authority with the Houston Health Department, sitting in for Director Stephen Williams. We have a lot of questions sent to us for this week, so let's start off with our first question. Are you concerned about rising numbers in other parts of the country? Will the warm weather here help us to stay low?
So I'll take a stab at that. So I'm not terribly worried about the numbers that are rising in other parts of the country. I took a look at, we're hearing a lot of talk about how Philadelphia has reinstituted their mask policy indoors. And I've been looking at New York City, and yes, both of those communities are seeing an uptick, but their uptick is starting at a really, really low level. The rate of increase in Philadelphia is faster than it is in New York City. So I suspect, and I don't mean to speak for Philadelphia, but what I think is that they're concerned not so much about how big the numbers are, but rather the rate of change is a little bit impressive. And so remember, these non-pharmaceutical interventions, social distancing, mask wearing, they only work if you get ahead of the situation, right? And so I think that's what they're trying to do, is to try to get ahead of it and flatten the curve as best they can. So could that happen here in Houston? It sure could, but is it necessarily going to happen here? No. Currently, our numbers are creeping up, but they're creeping up at a steady rate. They're not doing that exponential thing that they're seeing in Philadelphia. Could that happen next week? Yep, but we're not seeing that just yet. So I'm paying attention, but I'm not worried.
Well, any anecdotal information about the duration of first boosters?
Yes, actually, it's more than anecdotal. There has been some scientific data that does show that protection tends to wane at about between 3 and 6 months, which is why the CDC has come out and recommended a second booster for those who are 50 years of age and older, and for the immunocompromised.
Thank you. So someone asked, so what are your thoughts about the second booster? But I'm going to add this. They also say, can you sort of give a rundown on who's eligible really about this second booster conversation?
Yeah, so this is a really complicated question. I'm going to invite Dr. Brown to chime in, even though we kind of go every other question. I'm going to let her chime in on this as well, because this is really complicated. And there's not a real, in my opinion, there's not a clear answer on this. Mm-hmm. So the recommendation or the guidance that came out from the FDA and the CDC really allows for people to get a second booster or a fourth shot. They're called both things. It's based on a couple of studies out of Israel. They were large studies. There were large numbers of people. They weren't perfect studies. And what they suggested was that we've seen waning after the first booster, and that with a second booster, people did get increased protection. But also that appears to be like, that may be a very relatively short duration of protection as well. It's a little early to know that, but that's one of the observations. Now, this leads to a bigger question. Part of it is, what are our expectations of vaccines? And so we use the term breakthrough as when people became infected afterwards. And when there are lots of breakthroughs, people started having loss of confidence in the vaccine. And that's problematic for me, because the vaccines really are supposed to prevent severe illness and hospitalization and death. Just like every year with influenza, a lot of people complain that, I got the flu shot and I still got the flu. Well, first of all, a lot of times when they say that, it wasn't the flu that they got, there was something else that they got. But even for those folks who got the flu, the goal of the vaccine is to prevent you from getting severe illness or getting hospitalized or dying. It's not really to 100% prevent people from getting any illness at all. So this gets really confused. So when it comes to this issue of the second booster, what I think that the FDA and the CDC are really looking at is that for those people that are really high risk of a really bad complication, so this is why they stress those over 65, those over 65 with immunocompromised illnesses, or those of over 50 with immunos, that's who they're stressing. So for somebody like me, so I'm over 60, but I'm relatively healthy. I got to tell you, I'm debating. I have not decided to get it yet. I'm not afraid of it. I've got my first 3 shots. That's not the issue. But I find that this is a challenging question. And for those who are at really high risk, it's probably worthwhile. For the rest of us, it's kind of in fact, the graphic that was just up there, if you read it carefully, the CDC on that graphic, on one level, it says, who should get the first booster, and then it says who can get the second booster. So there's a little bit of qualification there, and I would really advise people to talk to their doctor if they have any questions about whether or not they think that they should get the second booster. There's not much of a downside, but let's say there is some downside, right? So, and these have gotten way too much attention in the media already. But the downside that I worry about is that there's a thing you'll hear called original antigenic sin, which basically what that means is you can overtrain your immune system to respond to one form by getting vaccinated against one form of a virus, such that you may not be able to respond when a new vaccine comes out to the new form of the virus. Now, we've not seen this in coronaviruses because we've never had vaccines for coronaviruses before, but we've seen it in a few other vaccines. So will that apply here? We just don't know. And the other thing is, we're entering into the summer months. So theoretically, even though we're starting to see an uptick in our numbers here locally, it's not a steep increase, it's a gentle increase, and we're entering the summer months. So maybe we don't, what am I protecting myself against? And again, this is a very complicated question. And this is why I really want Dr. Brown to chime in, because I clearly don't have all the answers to it. I've just kind of give you a lot of my opinion. Dr. Brown?
Thank you. I think you've answered actually a lot of the questions that are coming up. I will say for myself anecdotally as well, I qualify for the booster. I personally have not gotten the booster yet. However, I did advise my father to get the booster, and he did get the booster because of his medical condition. So I would agree, David, that I think that to your point, I think it's really important to note, I have no concern about the booster itself and side effects, and I have no concern about that at all. For me, it's just is it worth it kind of question. I think it is worth it for sure for some. The is it worth it piece for me comes because we are seeing data that shows that all of the immunizations may not be as effective against the Omicron variants, right? Which is where we are today. Does that mean that they won't be effective against any variants that will come? Not may come, but will come, because that's what viruses do, is mutate. I think that for some who are at high risk, it's important to weigh that question. And perhaps one of the things you said, David, which is very important, get ahead of it. So I do think there's a certain group of people that it absolutely 100% makes sense to go ahead and get the booster. I don't think, to your point, there's a huge concern about over vaccinating. Is it possible? Yes, but there's a whole lot of things, right, in the world that are possible. But the risk versus the benefit, I think the benefit far outweighs. So again, to your point, very, very complicated question. I think it's a very personalized question where it's one perhaps to have conversation with your primary care physician about the risks versus the benefits for you. But I think the key takeaways are, the question is not around, is it safe? Do we have concerns about any side effects? I want to be really, really clear about that. And I think that's very important as people consider whether they want the second booster or not.
Let me add on something, because I think you made a really important point. What we're talking about is the risk benefit of two really, really tiny risks. Mm-hmm. So even in the Israeli study, for the people over the age of 65 who were in that study, the rate of people becoming infected was 1 out of 200. So first of all, the rate of people getting infected was really small. And then within those who had gotten who had not gotten the second booster, they had a rate of dying of 1 in 4,000 versus those who got the booster of 1 in 22,000. So yeah, 1 in 4,000, 1 in 22,000, that's a big difference. But we're starting with only 1 out of 200 people even getting infected in the first place. So We're talking about, a big difference of two really tiny numbers. Between those two really tiny numbers, there's a big difference between them, but they're really tiny. Versus, what are the risks of getting vaccinated? Well, those are really tiny too. So we're trying to weigh tiny numbers against each other. That's why it's so hard to see what's the right answer.
I feel like I had the best doctor visit with two phenomenal physicians. If I didn't have a primary care doctor, I tell you, I feel so privileged. Thank you guys. That was excellent, honest narrative information. And to your point, it really is a personalized consideration, but you framed it so well. So I'll send you my copay. Thank you. The next question. So there'll be a couple together, so maybe real quick. Any idea how many have received their third dose? And if the side effects are consistent with all shots of the same vaccine, so maybe a county consideration and a city consideration?
So for the county, the registries are showing that over 1 million doses of the booster shots have been given. Now, what I don't know is, does that county data also include Houston data, because it is in Harris County? So David, I'll defer to you on that.
Yeah, so I should be able to pull that up, and I don't have it right in front of me. I don't know what our numbers are, but and Dr. White, you may know. So I think that we're looking at around 70% of Houstonians have gotten the first series.
Mm-hmm.
But if I remember correctly, we're only looking around 40% of people have been boosted so far. And so I think the big takeaway is really for those folks who got your first series but didn't get boosted. One thing we clearly know is that first booster compared to your initial series really does provide you a whole lot more protection against Omicron, which is the variant that's around here now. So when we talk about, we just had this long discussion about the second booster. The important thing is for those who haven't gotten your first booster but are eligible, you really need to go and do that, because that's a no-brainer.
So what are your thoughts? Someone says, I've had my first 3 vaccines, so that sounds like they've had their booster. If they're considering getting the second booster, should they stay with the same manufacturer, or should they consider switching?
So you should stay with the same manufacturer unless your first shot was J&J, in which case you should get an mRNA then.
I would add, though, that it is allowable to mix and match, that we have not seen any complications from that. And mix and match, to David's point, specifically with either Moderna or Pfizer. If you've had J&J, you need to get an mRNA vaccine, which is Moderna or Pfizer.
Great. And I think you guys answered this one. If you will be in a large group event, would you get the 4th shot if eligible? And I think, Dr. Brown, you mentioned, really it's weighing your risk and benefits about your own personal health considerations.
Mm-hmm.
There's still a large percentage of young people who are not up to date on their COVID vaccines. Why do you think that is?
Again, I think that's a really complicated question. I think there are a lot of reasons out there around vaccine hesitancy. Some of it, though, I think is purely data driven, in that those who are young are the children, and we're still catching up and getting them vaccinated. The second piece to that, though, is, again, these are children, and when you have parents who are not in full support of vaccination, obviously they speak for their children. And so there's part of it as well. As we should, when we look at what we're doing and what we're giving to our children, right? We're very, very careful about that, as we should be. So again, I think it goes back to our previous conversation about just people's personal feelings about that. However, I would say, personally, I absolutely vaccinated all of my children, including my youngest, who is under the age of 18. And I had no question about the risk of that versus the benefits, especially in going back to school and participating in sports activities, et cetera.
Thank you. Okay, we're switching to our pets. We love our pets. So can a human give COVID to a dog? And is there any way to tell, if so, that an animal has COVID?
So the answer to that is technically yes, you can. However, there have only been a handful, probably less than 5, I think, cases of dogs that have been found to be infected with COVID. In fact, I say that only because I'm aware of 2 dogs, and I don't remember what country it was. But so I say less than 5 because I just want to buffer my answer a little bit in case there's others. So you can give it to the dogs. Now, but dogs are rare. Now, cats can get it they're again, very rare, but there's more likelihood that a cat would contract it from their owner. And I don't know how you tell if the dog has COVID. It would probably have the same sort of similar symptoms. You take it to the vet, they would test it. Yeah.
They do, David. So in fact, they do. As you know, we have, and you all, I'm sure, have veterinary services as well. They do. It literally identical symptoms. They get a cold.
Yeah.
Wow. Thank you. Okay, someone asked, is Corvax approved in the U.S.?
No, it's not approved in the U.S. It's emergency use in India, and we have yet to approve it.
Okay. What would you say to a parent who still refuses to permit their 18-year-old child, under 18-year-old child, to get a vaccine? Doesn't the child have their rights if they want to be vaccinated?
Yeah, so this is a good question. And there are certain medical interventions that those under the age of 18 can get without parental advice, but the COVID vaccine, I don't believe, is on that list. So yeah, you gotta, mom and dad still get to say. And what I would say to them is, what I say to everybody is, your child is likely to do well if they would, become ill with it. Chances are, yes, we have had some kids have terrible outcomes, but it's rare. The bigger risk is, are they going to then spread it to some other vulnerable member of your family? Because one thing we found is that, well, yes, there is transmission of virus at work and at play and stuff. The most likely person you're going to become infected by, and the person you're most likely to infect, is a member of your own family.
Let's see. Have recently heard several people speak out and say they've had no vaccines. It seems to be more acceptable to admit recently, with the number of cases being lower, that you've not been vaccinated. Any idea how many in our area are unvaccinated?
So we kind of touched on the question a little bit earlier. Over 78% of the population in Harris County have been vaccinated. So that leaves roughly 22% that are unvaccinated.
If a targeted booster is predicted for June, shouldn't we wait for it instead of rushing out now to get more of the same?
So, this is a part of this complicated question that we talked about earlier. And a lot of that, so June is a couple months away, and it'd be the middle of the summer, and theoretically that's not viral season. However, this virus has shown us 2 summers in a row that it can attack during the summer. So I don't know how much. At some point, I anticipate. Recently, I've been saying, if you want to make a mistake in this business, being public health, make a prediction. So let me go ahead and make a prediction. But my prediction will be that eventually, at some point, this virus will fall into the seasonal pattern that other respiratory viruses do. But because it's a pandemic and we have such, we've had in the past, we've had so little herd immunity, it didn't really matter what the weather pattern was because we were spreading it amongst ourselves. And the weather pattern had little to do on the influence, which the other viruses, rhinovirus, cold virus, influenza, they're relatively endemic. And so the weather, then it does have an ability to have an impact because there's enough herd immunity for those. So, somebody recently told me that, getting, and I don't know that I agree with this, but they liken getting a booster shot in June to getting the flu shot in May. It's like the season will be over, and at some point we'll be there. Are we going to be there this year? I don't know, because right now our numbers are starting to creep up a little bit, and we are really at the very tail end of respiratory viral season, and our numbers are starting to creep up. So I don't know.
So it's starting to look like the beginning of the pandemic in China. What are your thoughts on the kind of lockdown they're doing in Shanghai? They're saying they're not wanting to consider the humanitarian issues, but what are the implications of a country where the virus is starting to increase doing a lockdown of, millions of people?
So I think that begs the conversation about what is the purpose of a lockdown. Right. So David just spoke about the risk of transmitting to other people. And Omicron is a highly contagious variant. And so the lockdown is to prevent the spread so that those who have it keep it to themselves. They go through the process and they hopefully and most often get better, and that it doesn't become a larger pandemic throughout China. It really doesn't have anything to do with the actual disease state other than mitigating spread. That being said, so it's one way, right? Along with hand washing, along with social distancing, it's a severe social distance, right? Which is why we do those things so that we can perhaps get ahead of things and use some preventive measures as opposed to some healing techniques. Okay. That being said, yes, I mean, absolutely, it has impact, global impact on some of our social aspects, on supply chain, et cetera. I think that becomes a very political question, frankly, around what is the value of mitigating the spread and potentially severe illness and death versus continuing supply chain and things like that, and the everyday life things that we know of. And I don't think that the two are can be compared, frankly. I think that it really is a question of, we're in a pandemic that none of us have ever seen before. Yes, the world has seen pandemics in the past, but we have not. The people who are living today have not. And so there's no playbook for it. It does absolutely, as we have seen in the last 2 years, alter our way of living and affect our way of living. But I think it's that in some ways it's more of a philosophical question about the social effects of that.
Great. Thank you, Dr. Brown. So we knew we wouldn't get away from wastewater, Dr. Purse.
Yeah.
What are you seeing in the wastewater? Is a surge coming?
Sorry, was I on mute that whole time? You just saw my lips
Yes, but
moving.
it looked great. It looked like it was really a great response.
I need to talk with my hands more. All right, so it's the viral load went from our all-time low of 18% to 25% to 31% to 38% most as of last week. That is a linear growth, right? That is not an exponential growth. That's a linear growth. So we'll have to wait and see if it continues or if it drops off. That is a tiny value compared to where we've been before. Remember, the other thing that complicates this is that 100% back in July 6, 2020 was the Alpha variant. And the one thing we learned with Omicron is that people have a lot more virus in their stool than they did with Omicron than they did with Alpha. So there's yet another sort of confounding variable with this. So it's rising at a really low rate. I'm not terribly worried about it at this point. The more important thing is that our hospitalizations have not gone up. In fact, they continue to very gently, very slowly continue to go down. So keeping an eye on it, not worried.
A question from someone at Rice, asking, Rice went back to masking in class. Do either of you know why they went back to masking in class?
The information that I am receiving, and first let me say this, I certainly do not mean to speak for Rice. So we probably want to reach out to them specifically for those answers. But it is our understanding, as far as the public health aspect, it is our understanding that there was, and I hate to use the term, I won't say that, there was an increase in infection after a large event at Rice. And so to David's point, though, I want to be very clear that an increase in infection at this point is still a very, very small number. However, similar to what we just discussed with China, to get ahead of things so that the spread did not continue throughout their undergraduate population, they made a conscious decision to go back to masking and a little bit more social distancing than previous.
So rapid fire. I have COVID fatigue, not from the virus, but from mask wearing and vaccination conversations, which inevitably end in an argument with some opinionated participant who criticizes anyone for still masking in a crowd. Have you found any good comebacks I could use?
Yeah. So my best comeback really is to just say, wow, that's really interesting, and turn and walk away. I'm not going to get into the argument.
I don't engage.
I don't engage. Yeah. I respect their opinion. I hope that they would respect mine, and I turn to walk away politely.
This week, there was an ad for a clinical trial for an mRNA flu vaccine. Is this a step toward a dual flu COVID shot?
In fact, there are studies being done, research being done to produce such a shot. So I didn't see the ad, but that is in the works.
where are we? 2020, we had no vaccines and many were hospitalized. 2021, vaccinations available with mostly only unvaccinated seriously ill. 2022, boosters available, but many still not completely taking them any at all. Any comments? And I think you guys maybe have commented about this earlier. Okay. Cardiologist Dr. Carr from McGovern School said the worst case, we could see a tsunami of heart attacks in the future because of the effects of COVID. What are you hearing?
So I've not heard, we've heard a lot about the myocarditis and pericarditis. I've not heard about, so remember, heart attacks, that's, plaque and cholesterol buildup inside your coronary arteries that ruptures and forms a sudden clot. So I've not heard that coronavirus is causing prolonged inflammation to the intimal surfaces of coronary arteries. On the other hand, this virus has broken every single rule and surprised us at every turn. So if Dr. Carr knows something I've not heard about yet, I will be disappointed but not shocked.
Variants. What percentage of cases in Houston are we noticing are the BA2 variant?
At this point, we're over 80%.
Are there any differences in symptoms between the Omicron and BA2?
No, not really. No, they're pretty much the same symptoms.
Yeah. Is the immunity to BA2 less than that to other variants?
No, I don't really understand that. If we're speaking about the vaccines, we have seen that there is potentially a little less coverage with the Omicron variant. But in general, the immunity after receiving your primary series and your first booster, as David mentioned earlier, is very good.
And is XE the same as BA2? I'm getting lost.
Yeah, so don't feel like you're alone. So XE really is a recombination of BA1 and BA2. So instead of it being a single mutation, it's like a little bit of BA1 got mixed up with a little bit of BA2, and now you got XE. So you're going to hear about XE, XF, XG. You're also going to hear about B3, B4, and B5. These are already out there, and they're talking about. The only ones you need to worry about are the ones that are spread more easily and start gaining traction and start spreading. So XE looks like it spreads about 10% faster than BA2, which is the leading, which is the horse leading the race right now. And it looks like XE is about 10% faster. But again, now it's coming into an environment where a lot of people are already infected with BA1 and BA2 and have immunization. So it not only does it have to spread faster, it also has to have a population with low enough immunity for it to become an issue. So it gets very confusing at this point in the pandemic as to what's going to happen next.
Well, I'd like to thank you for joining us today for the COVID-19 talks with our local health authorities. We've had Dr. Erica Brown representing Harris County, Dr. David Purse representing the City of Houston. Special thanks to past President Kathy Finnegar of the Rotary Club of Houston. Thanks to our producer, Morgan Ash. I'm Janina White, Deputy Health Authority for the Houston Health Department. Have a great day.